Heart and blood pressure. Tutorial by Gloriana and Cecilia. Deoxygenated. The blood enters the right side of the heart through the superior vena cava and the inferior vena cava. From there, it goes to the right atrium. Then, the blood goes through the tricuspid valve into the right ventricle. From there, the blood goes through the pulmonary valve into the pulmonary artery. The other part of the heart, oxygenated blood enters the heart through the pulmonary veins into the left atrium. Then, the blood goes through the mitral valve into the left ventricle. From there, the blood goes through the aortic valve into the aorta. Here, you can see the blood flow through the heart more clearly. Heart rate and blood pressure. Heart rate. What is heart rate? Heart rate is the number of times a heart beats per minute. How do I find my heart rate? Sit or lie down. After that, put the tip of your index finger and long finger in the groove of your neck along your windpipe to feel the pulse. Apply enough pressure so you can feel the beat. Count the amount of beats for 15 seconds, then multiply that number by 4. Any number between 60 to 100 beats per minute is considered a normal heart rate. Blood pressure. What is blood pressure? Blood pressure is the force of blood pushing against the walls of your arteries. It's measured using two numbers, systolic and diastolic. Systolic is the pressure when your heart beats, when blood pressure is highest. Diastolic pressure is the pressure when your heart is at rest, between beats when blood pressure is lowest. A normal blood pressure level is at or less than 120/80. How do I find my blood pressure? Blood pressure with a blood pressure cuff. You first need to sit in a chair with your feet flat on the floor. It needs to be resting on a table so it's level with your heart. It needs to be above your elbow. Inflate the cuff until the pressure gauge reaches the number 180. Loosen the valve on the bulb counterclockwise. Turn it slowly until you see the needle and the pressure gauge drop steadily. Where the needle starts to move up and down is going to be your systolic pressure. The needle starts to drop normally again, that means you've reached your diastolic pressure. This is the front of the heart, and this is the back of the heart. In this part of the tutorial, we're labeling the different pathways in the heart. In this part, I'm getting time from the superior vena cava through the pulmonary artery to show the pathway of deoxygenated blood. Here you can see all the pathways, both deoxygenated blood, which is the blue, deoxygenated, which is red. Most hearts work the same way, but sometimes some people are born with heart defects. One of those is called atrial septal defect, which means that the two atriums have a hole or just aren't separated, which mixes the deoxygenated blood with oxygenated blood together. This is a problem because this lowers the oxygen in the blood and makes the heart work harder to deliver oxygen to the body. Luckily, doctors can repair this by procedure or surgery.